If you are ready for the latest science-backed tips and tricks for accomplishing lasting weight loss, utilizing some of the methods that I have found over my 20 years experience that have been extremely effective with regards to fasting and which supplements and which protocols to follow, in this video, I break it down, guys, so you're not gonna wanna miss it. In the essential supplements, there's a curcumazorb and a resveratrol. And curcumin and resveratrol have really become part of the essential. I label them the anti-inflammatory, and we talk about supplements outside of the essential being optional, but curcumin and resveratrol really isn't optional. I think the majority of you will benefit from adding some additional anti-inflammatory. And so curcumazorb is just curcumin, which is the active ingredient in turmeric and is very powerful anti-inflammatory compound. And then resveratrol has some anti-inflammatory, some antioxidants, some anti-aging benefits, and there's some literature that talks about their synergistic effect together. That's why I always combine, for an anti-inflammatory potent supplement approach, I combine both and recommend both. When you're on bioidentical hormone replacement therapy and you're taking bioidentical estrogen, very little concern with regards to adding resveratrol. There can be some interactions, which is why some people will notice a potential effect. But if you're working with a practitioner, whether it's ours or someone else, if the blood levels ever look weird, just let the practitioner know you're taking resveratrol, but there's no issue at all. Preventing dehydration and under-eating from appetite suppression, building proper habits. GLP-1 medications are amazing, guys, and we know that they do so much positive. But like anything, they have their downside, and the downside, the side effects, the risks, all that. But another downside that's not talked about as much is they're so powerful at the suppression of the appetite, and also some people even, it's less often, but some people even have a difficult time drinking enough water. And we know how important it is to stay hydrated. So we have to be aware that might happen, and it's something that we have to be aware of, and we have to build proper habits to overcome the potential issues that can rise from not eating enough and not drinking enough water. So let's just establish the baseline for both. Good formula for adequate hydration intake is about 50 to 60% of your weight in ounces of water. Simple formula to follow. So if you weigh 200 pounds, about 110, 120 ounces, somewhere in that ballpark. You don't have to be super meticulous, but that kind of gives you an idea, a general range. For food intake, you should be striving to, and I know we're not counting calories, but this is what the goal is, and we're going to talk about that in a second, but you should be striving to consume at your total energy expenditure, right? That total energy expenditure is supposed to be, right? It's an estimate of the total amount of calories that your body is burning over a 24-hour period, and it factors not just the basal portion, which is that what you burn at rest, but it also factors everything else, your activity level and all that. And so you should be striving to consume that much, and this is why we really stress the importance of doing a calorie counting experiment for 3 weeks. Unless you already have a tremendous amount of experience counting calories in the past. A good 3-week calorie counting experiment, I talked about that last week, that gives you a baseline so that moving forward in this program, you build this intuition, this ability to reference what a day should look like. And that's really important because for a lot of people, you're going to have to override your own hunger cues because you're in this fake sort of situation, you're in this altered situation where your normal hunger cues are not accurate because the medication is creating this powerful artificial suppression. And so got to be more conscious about your intake of water and more conscious of how much food you're eating alongside protein too. So some of the newer literature coming out about your approach towards water, right? It's not so much just getting enough water in, although that's important, but the time of the day of when you drink is also important too as well. So it seems to be that your circadian rhythm is affecting the way that your body actually handles and processes water. So to make it really simple, you basically want to consume more of your water in the first 3/4 of the day, right? So best formula is as soon as you wake up, that's when you're going to drink a glass to 2. And if you're struggling, I would just say 2. Just shoot for 2 glasses of water as soon as you wake up. That will be a good time to add some electrolytes. If you are taking electrolytes every day, you certainly don't have to. I only make it mandatory when you're fasting for 24 hours or more. But your day-to-day, if you feel better, great. Doesn't have to be a requirement necessarily. You wake up, 2 glasses of water, and then the ideal pattern is to continue drinking water pretty consistently throughout the day. All the way up to a couple hours before dinner, depending on what time you're eating dinner. And then that last quarter of the day, that last 4-hour period is when you should start decreasing. And really at that point, just drinking enough to satiate any sort of thirsty feeling. But outside of a thirsty feeling, like, you're done. A lot of reasons for that. Again, the way that your body's able to actually utilize the water is the main reason. But also, too, there's a little tip from this aspect. By doing that, you're less likely to have to wake up in the middle of the night and pee. So if you are a person who's waking up multiple times to pee, there could be many reasons for that, but one could just be you're drinking too much water in the evening. And this actually happens to people in an effort to go, oh my gosh, I'm not drinking enough, right? And I used to be guilty of this myself too, where if I realized after a busy day I wasn't drinking enough, all of a sudden I think in my head, I better play catch up. And if you play catch up closer to bed, you pay for it. And it's more likely, even more problematic to do that and have a lower quality sleep that night because you're waking up multiple times to pee because you pounded a bunch of water. In that situation, if you skipped an entire day, you should drink some, maybe a little bit more, but don't try to just make up for the rest of the day. You're already very deficient. Just drink enough to satiate the natural thirsty cues that you have, and then go to bed, and then a new day, a new opportunity to hit your hydration goals. Okay? Now, tips to ensure that you hit your target intake of water. There's a lot, but I'm going to give you some of my favorite cues and tips and tricks. So we talked about just starting off the day with 2 glasses. I think that's a great opportunity to get a head start to your hydration because you haven't drinking from so many hours, obviously, because you wake up. So you start off the day, boom, couple cups of water. I like to have visual cues. So depending on where you work, that's probably the most important area to always have, like this. You guys have seen me, you guys have seen this, right? I pretty much, it's just a habit that I've built that there is always a jug of water near my desk. I promise you, depending on what kind of job you have, obviously, if you don't like your job and your mind's not on your job, then maybe it's easy to remember water. But when you got a busy job and you're occupied, you need cues. And so cues are probably the most powerful tip for adequate hydration. Please don't be drinking out of plastic waters. I think we've gone beyond that point. If you buy the bottle, fine in the moment, but don't be reusing plastic bottles. Get a container, $30 off Amazon. Leave one at the office so that you can, assuming you have an ability to replenish it with some high quality water at work, leave one at the office, leave one by your desk at home, leave them as many places as you can where you spend time so that you just have that constant reminder. So that's a good cue. Another thing is alarms. Right? We have alarms on our smartphone for a reason. And if you are struggling to get enough water intake, then set an alarm. Don't think you have to do that for life, but this could be a good way to build this pattern 3 weeks, 4 weeks, and then it becomes automatic. Alarms, visual cues, and carrying water with you would be in that similar category to visual cues. If you do a lot of traveling, that's a big deal. Same thing, when I travel, I always have that with me. I'm in an airport, wherever I'm at, that's always around me. And then finally, I like the urine test. So look at your urine. You look at your urine, and based off of how dark it is, that gives you, it's not 100% accurate, but it does give you an idea of where, in that moment, how much water you have. Because if you're more hydrated, your urine is lighter color, and if you're more dehydrated, your urine is darker color. So don't be shooting for clear, but a light yellow is a good goal. Now, obviously, exceptions is you take a bunch of supplements where you're going to have an automatically dark urine. So you have to equate for that and know that you don't need to pound a bunch because it's super yellow. That's from your supplements. But aside from that, it's a pretty relative consistent cue. Is you want to see You wake up in the morning, you're taking your supplements in the morning, so you're going to have obviously dark urine for those first 1 or 2 times in the morning because you just took a bunch of supplements and you're catching up. But by late morning, midday, you're looking at your urine and it's starting to become lighter colored. And it should just stay lighter colored. So if you get it to be lighter colored and then all of a sudden you don't drink anything till dinner time and you pee again, it might be darker again. That's a good reminder that you failed to stay hydrated. Because the optimal way that your body will utilize the water, and this is optimal, guys, this isn't something that you need to freak out and stress out about, but optimal is consistently sipping throughout the day. And so your body doesn't do as well when you go 2 or 3 hours and try to catch up. It'll just excrete that water and it'll pull some electrolytes. So that can be problematic. That's why I've talked about if you go on a whole day, don't just chug a bunch. You're just going to actually dehydrate yourself from an electrolyte perspective. Hydration is just as much the actual H2O as much as it is electrolytes. So a consistent flow to the best of your ability with a bigger intake in the water and a wean off in the evening. Those are your patterns and those are your cues. Okay, so now let's talk food. So a couple tips and tricks that I recommend. Number one, remember that, again, this is why when people ask the question, what is the best dose of tirzepatide or semaglutide, GLP-1 medications when you are using them for weight loss? We're not talking about diabetes management. That's a whole different thing. But if you're using them for weight loss, the best dose is the lowest dose that allows you to implement the flow protocol, meaning implement the fasting and also improve your overall approach towards food. It's not just being able to get into the fasting. It's also knocking off and stop eating so much crap. Stop eating so much junk food. A lot of us have a lot of food chatter and we're just eating like crap consistently. So we got to decrease that consumption of processed food. And you guys know that we shoot for the 90-10 rule. So again, the optimal dose is the lowest dose that allows you to both get into the flow protocol of fasting and improve that consumption of food, striving for that 90-10 rule. All right. So planning your meals doesn't have to be insanely methodical, but just knowing when you are going to eat so that you're not waiting for hunger because your hunger cues are not going to be accurate. Also, just planning your meals. Like you're going to be eating your first meal around 12. What does that look like? What are you going to do? What's the plan? Are you going to buy something? Are you going to bring something? Are you bringing a can of sardines? Are you going to be going out to eat? What's that day look like? Oh, I'm going to be out to eat. Okay, great. I'm going to go out. I'm going to eat, right? So having some amount of plan without overthinking it is a good way to ensure that the day doesn't, because when you get busy, just like water, it's a very similar thing. Just like water, you don't have the hunger cues, you get busy and bam, you fasted for 24 hours, which is problematic because we just fasted for 48 on the other part of the week. So we can't do that. That's why we don't recommend OMAD. The foods we are eating, we can make them super dense. Like caloric dense foods also can be the solution as well. Superfood shakes, blending an entire avocado with coconut milk and in various healthy fat sources like chia seeds, throwing in a couple scoops of protein powder. You can get a really high calorie shake in a situation like that. Now, obviously, I don't want you drinking your calories all the time, but if that's what it takes to get enough calories, I'll take that. I will take that. You cannot let yourself be slipping into that pattern. Otherwise, you're going to likely hit a plateau. Like, how can you tell if a plateau is coming early? The symptoms like brain fog, lower energy. If you feel that, or if you're losing more than 1.5% of your body weight per week, then you are probably under eating. If you're lucky enough to get away with not hitting a plateau, then good for you. But the reality is that most people will hit a plateau if they are in a deficit of calories for too long of a period. So I'm setting this up to teach you guys exactly the best strategies that are going to work for the most amount of people. Some people are lucky. They could starve all their fat off. And what I mean by that is just massive calorie deficit over a period of time. And they just like, weight loss is easy. And then the rest of individuals are like, oh my gosh, I barely restrict my calories and my body's already trying to resist that. And so that's why we know there's a lot more to this than just hormones or than just calories. And what that is referring to as hormones. So you got to do your best. And as If it's not an issue, it's not an issue. So you're under eating a little bit, but you're still losing weight consistently. It's not slowing down. You're not going to a plateau. Great. But if you start to feel like it's coming, then you know why. Going beyond the 48-hour fast. Yes, there are benefits, but let's expand on this because this is really important. So let's start with why the Flow protocol centers around 48 hours per week. There's a lot of science and creativity behind that. This is what I figured out from my research and experience, the limited data that we have in terms of medical literature, and just working with patients and myself for so long. So, as we know, fasting is the most extreme version of calorie deficit, of calorie restriction. There's a ton of crossover between calorie restriction and fasting, but I think fasting is much more powerful for so many reasons, and I've done tons of videos on that. But as a reminder, fasting is, in essence, the most extreme version of calorie restriction over a defined period of time, okay? So we know also that calorie restriction over time leads to a plateau. And within the matrix of everybody's individual variability, we talked about that earlier, how some people can get away with not hitting a plateau and other people just plateau right away. So there's individual variability coupled with the fact that we also know to be true, the greater the calorie deficit, the faster an individual plateau. That is a constant. The greater the calorie restriction that you're consistent with, so I should say the greater the consistent calorie restriction is, the faster you will plateau. So that's a true statement. So fasting, right, 0 or 10, very as close to 0 calories as possible, everybody seems to hit that point about 4 to 5 days. So within a 4 to 5 day period, many people would say you're no longer fasting, you're starving, but that's another philosophical question and debate, really. But most people will experience metabolic downregulation about 4 to 5 days into a fast. The 48 is just my opinion of the most aggressive, this is what it is, the most aggressive fasting that most people could do in a repetitive weekly format that is going to avoid that metabolic downregulation. If we start getting into 72, even 72, I never do you ever see me tell you guys do that every single week. I do it for extreme measures in situations with extreme circumstances with certain patients, but for a standard protocol, it's too much, in my opinion. I think because that's 3 out of 7 days. Your weekly calories, you're gonna plateau, right? And then not to mention adequate protein and nutrients and all the other things you need. It's too much. And for some people, 48 is going to be too much. But again, what's going to work for the most amount of people, I have found to be 48. So a lot of science and a lot of creativity and intuition is how I landed on 48 hours per week. So on that same topic, let's just talk about those benefits, right? So there are cons, the metabolic downregulation of exceeding 4-day fast, but there's plenty of books. And I would say there's plenty of cases where people have gone the distance and pushed their fasting for 4, 5, 7, freaking 14 days and had miraculous changes. There's plenty of books on this. Unfortunately, there's very little to almost no clinical data on this, which is why most experts would say never do that. And I'm not telling you to do that. I'm not giving you guys medical advice. Any sort of fasting that extreme, which is well beyond the Flow protocol, you always need to talk to your primary care physicians. But there is something to be said about the plethora of all this data, case studies of people sharing their experiences with long format fasting. And you guys have heard me talk about Angus Barry, the man who fasted for an entire year. A lot of people think that I'm lying when I bring that up. You can look him up, Angus Barry. He lost like 250 pounds and he fasted for a year. It's crazy. And he was observed and he was kept safe and they learned a lot and fortunately never did anything. So again, my opinion, my intuition is that yes, you will experience metabolic downregulation, but there are other benefits outside of that could be monumental and game-changing for an individual's health. And the metabolic downregulation will recover. You will recover from that, but it's a huge stressor. So the flow protocol is a great way to get to this healthy state. You lose your weight, you're very metabolically flexible, you're very metabolically fit. And then if you want to push it up a notch, which this is one of the things that we're going to be doing in the Flow Lifestyle group, pushing the envelope with longer format fasting, and I'll be doing it with you guys. So I'm super excited about that. I think it's going to be really fun. But the cellular autophagy potential is very high. That is something that a relatively healthy person could consider to take their health to the next level. If you guys found that informative and helpful regarding tips and tricks for lasting weight loss, then you're gonna wanna watch this next video where I break down even more strategies and the things that I find most effective for my private paying group. I hope you guys enjoy.